When we look at differences and what we used in the project care study, we used a health equity framework and we used a social determinants of health framework. And the social determinants of health framework is really a framework that not only looks at health factors, but it looks at the comprehensive nature of where we live, work, and play, and how all of that contributes to health. And so, what we saw is that communities that not only had extensive disease burden also had lower income. They also had housing insecurity, food insecurity, lower educational attainment. So, all of those factors together help create a structural inequity that leads to unhealthy communities. And so what we have done in Fulton County is really work with a variety of different partners across the county to first of all provide or restore healthcare access points. We've added three primary care clinics, one in partnership with Morehouse School of Medicine in East Point. We also have partnered with Grady Health System to add two additional primary care clinics. And so restoring healthcare access points was one of the things that we did immediately.
I think as a result of COVID, we're finding ourselves in a more difficult and challenging environment where it's difficult to recruit licensed clinicians to provide that therapeutic intervention. One unique thing that the Fulton County Department of Behavioral Health and Developmental Disabilities implemented in 2018 is that we actually contracted out our behavioral health services. So we have contracts with multiple providers to deliver the service on our behalf. And so one of the positive outcomes of having contracted agencies is that when we find ourselves in need of additional capacity, we're able to leverage one of our contracts to increase our presence in the community. I know a lot of agencies are transitioning to the certified community behavioral health system. It's a kind of a network of providers working together to deliver a service. And I think that is the wave of the future, is to have a collaboration with multiple agencies delivering a service to serve a community. Absolutely. So trauma-informed care is all about recognizing that an individual may have been exposed to trauma at some point in their life, perhaps as a youth, a child. And so how do you implement therapeutic interventions to ensure that you do not re-traumatize someone, right? That you're tapping into their life experiences and taking those into consideration as you try to assist this person with becoming healthy and whole. And so just exploring with our clients any potential traumatic experience that they have witnessed or encountered. How do we work together to get you to the next step? And we use multiple assessments to determine from your entry point, what is your risk assessment score, depending on what we use, right? But what was your acuity at the point that we encountered you as our client? And then 3 months later, where are you? 6 months later, where are you? If it's a you, sometimes it may be a year later, where are you? So just going back and doing a pulse check on those assessments. So you assess, reassess, reassess, reassess to ensure that what you're doing, the interventions you're implementing are making a difference.
I think one of the biggest lessons was the amount of collaboration that we needed, perhaps even earlier than we started. We invested the land for the facility as well as the capital dollars because our board, they were just that committed to the cause. And so getting and having a champion within your organization, whether it's private or within government, is very important. We could not have made this significant transformational impact without that. And what led to that is doing all of the research up front, all of the education that needed to take place to help them understand how significant this investment or need was and what it would take to stand it up. And then going to our legislature, understanding who we needed to speak with, having a strategy around that. I would say understanding who all of your stakeholders are, getting a champion, and really crafting the need in a way that is understandable to a broad audience of stakeholders.
One thing I realized is taking on the role as a director of behavioral health in 2017. However, being with the county since 2008, is that behavioral health in itself, which is your mental health disorders, your substance use disorders, is not an assignment that can be completed in a box, right? Because what we find is that individuals that are suffering, and when I say suffering, is that they have a mental health disorder or a substance use disorder and they're not seeking treatment. They're self medicating or they're allowing themselves to spiral downward without getting help. What that leads to is that when we're attempting to work with someone with a mental health or a substance use disorder, I'm not going to say 9 times out of 10, let's just say 50-50, 5 times out of 10. At this point, there's some judicial involved, right? So now we have to figure out how do we ensure that as a behavioral health department, we are working with the judicial system, we're working with the school system, we're working with the jail, we're working with our housing partners, because people need to be treated holistically. So you're not going to sit in a room with me and try to address your mental health symptoms when I don't know where I'm sleeping tomorrow. I don't know how I'm gonna feed my children. I'm getting ready to get kicked out of school. So what we have done in response to that is that we've cultivated a really strong partnership with our judicial partners. So we've worked with Misdemeanor Mental Health Court, which is magistrate and state court. We've partnered with DUI court because if an individual gets a DUI charge, they do have the option to seek treatment. And so through the treatment protocol, they would participate in treatment for up to a year, depending on the charge, and we would just report back to the court. The school-based mental health, imperative, right? Our kids are going to school fearful. The parents are fearful. You know, I don't want to get a phone call saying something's going on at your school. So what we did in response to COVID is that we actually partner with 2 agencies and we provide funding for them to provide therapists within the schools. So we are present in 66 schools throughout Fulton County to ensure that the students have access to therapeutic interventions during school hours. We also implemented a text for help program, which is a number that they can just text and a licensed clinician will respond back to them within 90 seconds. We partner with the city of Atlanta on a permanent supportive housing initiative. And what that means is that our goal is to ensure that 550 individuals transition from unsheltered to sheltered. We partner with the Fulton County Jail to implement a implement a screening and reentry unit. And what that means is that every single person that's booked into the jail that is eligible, because they may get discharged or released prior to getting to this step, is that they complete what we call a correctional mental health screening. And what that does is it gives us an early detection as, hey, someone may need to consult with this individual because there may be a mental health need here.